Hello everyone. Today we will talk about non-stress test, that is NST. So what do you mean by NST or non-stress test? Don't worry, it is not a stressful test. It is to check the baby well-being during the third trimester of pregnancy. Now start with the introduction. A fetal non-stress test is a simple, non-invasive test. It is performed in pregnancies over 28 weeks of gestation. The test is named non-stress because no stress is placed on the fetus during this test. So the definition, it is a continuous electronic fetal monitoring of fetal heart rate with recording of fetal movement in cardiotocography and wellness of fetus. Or it is a method used to test fetal well-being before the onset of labor. Now, what is the purpose of non-stress test? Assessment of fetal well-being or to evaluate the ability of fetal heart rate to accelerate, to know the oxygen supply to the fetus, and to know the need of further monitoring and testing. What are the indications for non-stress test? That is gestational diabetes mellitus, high blood pressure, or some other medical condition that could affect pregnancy, gestational hypertension, or baby can appear to be small or not growing properly in the womb or less active than normal baby. Have too much or too little amniotic fluid. Patient had a procedure such as an external cephalic version to turn a breech baby. Third trimester after amniocentesis to see how baby is holding up during his extended stay in the womb. In previously lost a baby in the second half of pregnancy without any reason, medical problem that may jeopardize the baby's health. If the baby has been diagnosed with an abnormality or birth defect and need to be monitored during the pregnancy, we do a NST test. Or if a baby is not moving as frequently as usual or pregnancy is over to due date, if there is any reason to suspect that placenta is not functioning adequately or any high risk for any other reasons, we do NST. Now, when to perform NST or non-stress test? NST are generally performed after a 28 week of gestation. Before the 28 week of gestation, the fetus is not developed enough to respond to the that test protocol. So we do a NST after the 28th week of gestation. Equipment we required for the NST is a non-stress test machine, a tray containing abdominal binding belt, stethoscope to evaluate the location of FHR, jelly and cotton pad, graph paper, Doppler Doppler transducer for fetal heart rate monitoring, pressure transducer for monitoring of uterine contraction and fetal movement, event marker for monitoring fetal movement. So this is the picture of NST machine. As you can see, there is two NST belts and connected with this NST machine connected with two probes, which one first is ultra transducer, uh, which can monitor a fetal heart rate, and another is transducer for monitoring of uterine contraction and fetal movement. This is the picture of performing a NST on pregnant mother. So now let's see the procedure for NST, how we perform NST. Before the examination, ask the mother for having some food or not. Advise the mother for voiding. It will prevent the interruption between the procedure. Explain the procedure to mother. Make the patient sit on a chair or lean back on exam table or a bed. Then fasten the two monitors, one to pick up the baby's heart rate and other sense uterine contraction. Allow the patient to hold a event marker and explain to click each time if she feel the baby movement. This NST procedure will be timed for 20 to 40 minutes. Monitoring is for 20 to 40 minutes. In NST, a baby who moves a lot and has a normal heart rate is classified as reactive NST. He is considered to be healthy. In a non-reactive, baby is not necessarily in danger. The baby should just be sleeping. Now, how we interpret the NST result? We interpret in a two section, reactive or non-reactive NST. Reactive NST is in reactive NST at least 2 FHR acceleration with or without any fetal movement occurring within the 20-minute period and peak at least 15 beats per minute above the baseline, and it should be last for the 15 seconds from the baseline. We consider it as a reactive interpretation. So this is the graph of NST. First graph is showing a FHR, fetal heart rate, in blue one, and the red indicate a contraction, uterine contraction, which we have to count according to the graphical presentation. And the next interpretation is non-reactive. It is the absence of fetal activity or no acceleration for 15 beats per minute or acceleration for less than 15 seconds in duration for 40 minutes is called non-reactive NST. There could be absence or there could not if there should be a acceleration but it does not long for a 15 beats per minute or does not long for a 15 second, so it should be a non-reactive NST. Now what are the advantages of this NST test? It is a non-invasive procedure. First of all, it is a non-invasive procedure. We does not require any invasive article in this procedure. Painless procedure, no risk for fetus or a mother. It is easy to administer weekly or daily. Results are available readily. At that time, at that moment, results are available. What are the disadvantages? False, the result often occurs since various methods have been used to stimulate fetus to elicit acceleration in fetal heart rate. So this is the picture how NST machine gave a recording of a test. You can see a graph paper which can show a upper portion shows the fetal heart rate and the lower graph shows the uterine contraction. So this is for the NST procedure or NST test. Thank you for watching. Like and subscribe my channel.